All right, 19 minutes after 10 o'clock. So the other day, we went downtown and we were participating in this fundraiser. It was a tavern hopping fundraiser. And it was fun. I got to see restaurants I didn't even know we had downtown, right?
Yeah.
And Robin, you had some relatives visiting from Wisconsin, and the lady in our group had recently had some back problems. And so we had 15 restaurants to hop from to run
in 4 hours.
In 4 hours,
yeah.
and she was just really getting worn out, and she let us know that she had some back issues. And we said, "Oh my gosh, well don't do anymore. Just stay right where you are." And so she missed out on the last 3 or 4 of them, I think, right?
Yeah, the last 2.
Yeah, the last 2.
Just the last 2.
That's okay. But she was.
Yeah.
I could tell she was worn out, right? Mm-hmm. And so maybe there was something we could have recommended to her. I don't really know that for a fact, but I do have somebody on the phone who might know. I'm trying to get the picture of his book on here. So you can see the book. There it is. Blueprint for Back Pain Relief is what it's called. It's written by our guest, Dr. Bradford Butler. He is on the phone. He's a chiropractor. He was named twice one of America's top chiropractors by the Consumer Research Council of America. He's the recipient of the New Jersey Top Doc Award for 8 consecutive years. He's the owner and director of Oakland Spine and Physical Therapy. The Blueprint for Back Pain Relief is on Amazon. That's where I found it, so you can go get it right there. It's got lots of great reviews. Dr. Butler, good morning, sir. It's an honor to have you on our show.
Good morning, and the pleasure's all mine.
You sound so great. I love when there's a clear phone signal, Robin.
I know, it's great. I love it.
Our thing is clear phone signals. Your thing is making sure people are without pain, right?
Yeah, correct. We both want high function, I guess.
Do you know, I never really knew how I felt about chiropractors. I mean, I know some, and these are really great guys, but I never really knew exactly how you would make a difference compared to other doctors until Robin had this issue where she had this unbelievable pain in her arm. So bad she had to go to the emergency room.
Yeah, that was...
Long story short, the emergency room couldn't do anything. It had to be done by a chiropractor. And the source of it, and I know you've heard this a million times, was not her arm at all. It was her back. Isn't that crazy?
Yeah.
Yeah, probably her neck.
Exactly.
Exactly.
Right at the base. See how good you are, right? So I would never have thought that a back issue doesn't get felt in the back. It gets felt in the arm.
Yeah, so if you think about the back, right, there's a lot of confusion, right? We think about the back as just this one kind of big area of our body, but really what chiropractors specialize in is the spine, which happens to sit inside your back. And the spine is the housing for the entire nervous system. So in Robin's case, she damaged a nerve in her lower neck probably, and she didn't feel the pain in her neck, but she felt the pain in the nerve that comes out from the neck down to your fingertips. So I can't tell you how many patients over the years have had numbness and tingling in their hands and wrists, and they thought it was carpal tunnel, but it had nothing to do with the carpal tunnel. It wasn't their hand at all. It was actually coming from their neck. And we're seeing more and more of these kinds of things, guys, really because of the sedentary lifestyles that we all live.
You clearly know your job, because that's exactly what happened. Everybody said it's carpal tunnel. Well, actually, the hospital didn't. They kind of knew right away that it was a chiropractor's job. So, which is good. It's good that you all know each other's roles in taking care of the rest of us.
That's evolved a lot over the last several decades, honestly, because, listen, we have the best medical doctors in the world in our country, and that's great. And it's great to know now that they're learning more and more about what we're the best at, which is helping people that have spine and nerve-related issues. And so we work up here in New Jersey with a lot of great surgeons and medical doctors. They refer their patients to us all the time. And likewise, we refer our patients to them when it's outside of our scope. So having a great team, I would love your listeners to know that, is probably one of the best assets that you could have as a patient, having a great team of people that specialize in different things.
Let me ask you something. The subtitle to your book is The Essential Guide to Non-Surgical Solutions. Have we also evolved from that? Have we started figuring out that you don't always need to cut into something to fix it?
I would love to say yes, but even though socially we discuss this, the facts are the opposite, that we're still doing more and more surgeries, and many of them are unnecessary. And really, depending on the research, my book is, and if people are interested, or if they're being kind of pressed with this issue, do I do surgery, do I not do surgery, I really encourage them to read the book, because I have all of the data. I've done tons of research in here as to when you should consider seeing a surgeon and when you shouldn't consider seeing a surgeon, because we live in a world where we go to the most extreme treatment when it comes to our spine first. And the reason that there's such a high failure rate is because in many cases with surgery, you don't need surgery in the first place. So what we really want to do is reverse that, and we want to start with the most conservative treatments first, because we can always have surgery. Does that make sense?
Yeah, absolutely. You would want to do the less invasive thing first, right?
Yeah, but our culture, we don't have that right now. We still live in a world where if we have neck or back pain, some people will run right to a orthopedic surgeon or a spinal specialist, and that's all they do. So if all they do is surgery, guess what? You shouldn't be surprised when they recommend surgery.
Well, I think we're kind of a mechanical world because we all drive cars and we all think our bodies are like cars. So you have to go under the hood, get the wrenches out, and remove something, or cut something open and fix it. But you cannot massage your car to fix your engine, but you can actually, with what you do, reach that thing that needs to be fixed through simple adjustment with your hands, which I think is amazing.
And we use a combination of therapies, Larry. In our company, we have the best physical therapist, the best acupuncturist, the best massage therapist, and chiropractor. So we always have operated from a team approach. And the reason for that, and again, I talk about in the book the 6 places that pain can actually come from. You just alluded to that. If you have neck pain, most people that are listening don't realize it's not one thing that's causing your pain. It's usually several things. It could be muscles, it could be nerves, it could be discs, it could be joints.
Really?
There's several different tissues. And where is the pain coming from? And that's really the expertise of the chiropractor.
Does the book, even though it says in the title back pain, would it also apply to headaches?
Yeah, so again, just like sort of what you were saying with Rob before, is there's a lot of peripheral symptoms that happen as a result of the spine not functioning normally. So headaches are one of the easiest things, believe it or not, for a chiropractor to fix. In the 90 percentile of patients that have suffered from migraines and headaches that have come to our clinics get better. And yet they've been living on Tylenol and Advil and Motrin and all these other drugs to cover up the symptom. They've never fixed the problem.
And there's so many warnings about using that stuff. The liver seems to be a real, an organ that is badly affected by most of those pain relief things, right? Yeah,
you're bringing up a great point. We use the term side effects in the medical world, but it's not really a side effect if it happens to you. It's an effect, right? So when you take Tylenol for an extended period of time and you're not following the directions, and we think it's safe because it's sold over the counter, right? So they wouldn't sell it over the counter if it was not safe. But the truth is, long-term exposure to Tylenol can create all sorts of issues.
But we like to try to diagnose ourselves and fix it before going to see a professional. But you really, truly are advising against that.
Listen, there's a difference between acute pain and chronic pain, and I would like to, for your listeners to know that any one of us could pick something up the wrong way and strain ourselves. And in many cases, you can self-treat that if it's not severe, and it goes away because it's acute, right? But what we're really concerned with is the chronic back pain or neck pain sufferer, because what that means is there's a long time that the problem's been going on, and so it's gotten worse over time. And I use the analogy of a dentist, right? So if we have tooth pain for a long period of time, we don't try and self-treat. We kind of figured out that it's probably better to go to the professional. And when it comes to chronic pain, it's the same thing. If you've had pain for more than just a few weeks, or even pain that comes and goes over a few months, that's considered chronic. You want to get professional recommendations as to what could be causing that.
I'm going to clump a few things together and just ask you to comment on them. And the few things are like a heating pad, an ice pack, and then the lotions that create the sensation of heat.
Oh, like icy hot or something.
Yeah, I mean, do those things, what are your thoughts on those 3 things? I don't even have a specific question. I just want to know if they work, I think.
Yeah, well, according to Shaquille O'Neal, icy hot fixes everything. If you've seen the TV commercials, no. But so the truth is, if you're looking to alleviate some of the soreness from a muscle, things like icy hot are great because they help to bring blood to the area, which helps to relax the muscle. But there is a debate about the heat and the ice thing that you were talking about. When it comes to therapy in general, ice for 24 hours, a combination of heat and ice for 48 hours, and after 72 hours, heat. But they're really only talking about muscles when they do that. When you're talking about nerves and joints, our recommendation is always when you have pain in your back or neck, never to use heat, because heat will actually increase the amount of inflammation in the area if there's an injury. So it'll feel good when you put it on initially.
Yeah.
Heat would feel good on anything when you put it on initially, by the way. You could break your arm and it would feel better with a hot pack around it. But what happens is when the opioids, the natural endorphins in the bloodstream, when they wear off, now we have more inflammation. We actually create more pain. So it creates this vicious cycle. Does that make sense? Where you're getting more pain, you put on more heat, it creates more inflammation, which is not good, which leads to more pain. So we recommend, and I touch on this in the book as well, we recommend that when it comes to the back, you want to focus mostly on just ice.
Oh, my.
Okay. And does it matter the kind of ice? The reason I'm asking that question is because I had this gel thing that I froze in the freezer, and it was cool because it kind of formed, it moved, but it melted really quick. You know what I mean? As opposed to just a bunch of ice cubes in a rag or something.
Yeah, I do. It's great to have a Ziploc and you fill it up halfway with ice and a little bit of water in there, and then you seal it, and that you can just keep reusing and it'll last a little longer. But the gel packs are great because they do conform to the area you're icing. So we get this question, believe it or not, in the office quite regularly. I always tell my patients to have a couple of them. That way you can rotate them out.
The book is called The Blueprint for Back Pain Relief. I found it on Amazon, and it looks like it's getting a lot of really good reviews. Oh, I clicked the wrong button. Now I went to Alexa. Do you have a website you'd like to recommend for us?
Sure. If anybody's interested in learning more about the book, they can go to drbradfordbutler.com, drbradfordbutler.com. And I just want to thank you for having me on here, but really letting your listeners know that the whole purpose for writing this book is after 20 years of practice, I've realized how patients or the general public don't know what to do. And I don't want them to make the wrong decision and do the most extreme thing first.
Right.
I'd love for them to learn more about their bodies, and the book will teach them about their body and the warning signals and how they can naturally help their bodies to heal quicker.
Good advice. I think the whole idea of finding a good chiropractor and taking the non-surgical approach first, and if that doesn't work, then I guess you take the next step. But I think that's really good advice. Dr. Bradford Butler, thank you for being on the show with us today.
It's been a pleasure. Thank you so much.
You're welcome. We'll be right back.